We were looking into trying to find other salvage therapies for our pediatric leukemia patients, and we saw that Cladribine has been integrated into the adult leukemia patients, and they are actually bringing it to the front line and having a really good survival outcome as well. So we wanted to look in our patients that have received Cladribine as part of their chemotherapy regimen, as part of their salvage. And this is when they have their, their second, their third, their fourth relapse and whatnot. And we wanted to see what was their outcome. Did they actually respond to Cladribine? This is something that we can bring it to the front lines and whatnot. So that's what we were trying to look into. We saw that just in the little bit of the literature search that we've done, there are some limited studies dating back up to 1991 trying to look at some of the pediatric patients. It was a small cohort that looked at Cladribine, and they saw that there's some good response, but again, that study had a small cohort, and it was very hard to look at the side effects as well. And another study that came out in the early 2000s as well looked at it and also showed that in those relapsed leukemia patients in pediatric, they had a better survival. So that raised the question, we've had those patients, let's look into their charts and try to answer some of the unanswered questions. So what we did is that we tried to look at patients from 2015, in January 2015, up to July 2023. We tried to identify patients that have received Cladribine during that time period. And we've identified a total of 161 patients during that time frame. But then we had some other exclusion criteria. We wanted to focus on our pediatric patients. So we looked at ages 1 to 21 years of age. And we also wanted to make sure that they actually completed a cycle of Cladribine as well to try to reduce any bias as well. And then they've received the Cladribine as part of their chemotherapy treatment. So we've identified narrowed our cohort to 35 patients. Most of them are males, around 60% of them are males. Most of them, around 17 of them had 3 or more therapies prior, so a lot of them were relapsed refractory patients. 31 of them are AML, which, again, the other studies that looked at Cladribine were used in AML, and the others were different variety of leukemia. Yes. And what we found in the results is we found that around 45% of those patients had complete response after they've received the Cladribine, and 11 of them did go to transplant after that as well. We also saw that the overall survival for our cohort of patients was around 1 year, and it ranged from 5 months to a 10 years period. Again, it still tells us that there's a lot of heterogeneity in our cohort as well. So we do need further larger studies to try to validate our data. What's important as well, it's good that we see some of that response. It may be not a good number when I tell you 45%, but when you look at those relapsed patients, a lot of their overall survival, specifically in AML, their overall survival is around 40%. So hopefully, as we try to introduce this to the public and try to raise awareness and try to make people think about Cladribine as an option, that could incite others to perform larger studies to try to evaluate it. Other things that we tried to look at is just how safe it is in our pediatric patients. So we looked at adverse events. The common thing that we've seen was hematological toxicity, and that's also reported in other studies. So febrile neutropenia was commonly seen in around 19 patients had febrile neutropenia. Thrombocytopenia, which is low platelet, was also present. Anemia was also present, but at a lesser degree than the thrombocytopenia and the febrile neutropenia. And then we saw that some mild increase in their liver enzymes and low potassium was also noted as well. But overall, we saw that even if they had that drop in their count, it was still fairly tolerated overall. So what we hope is, this study can that can help inform future larger studies to confirm our findings and try to, look into Cladribine as a salvage therapy for our relapsed leukemia, and maybe, that could offer hope for other patients who don't have any other options as well.